I'm Dr. Joshua Yamamoto, and in honorary of February being Heart Month, I thought we'd talk a little bit about the modern way of thinking about heart disease. Brought to you, of course, by the Foxall Foundation. We're a nonprofit organization with a educational and research mission helping everybody age well. Now, one of the things we like to emphasize at the foundation is that good health isn't something that just happens. It's something that we all must build as we age. Heart disease remains number one, the leading cause of death worldwide, not just in this country. And so if we're going to talk about heart disease, it's important to actually know what we're talking about so we can understand how to manage it in modern times. So first, a couple of definitions. As we throw about terms frequently without bothering to explain them, a heart attack. What's a heart attack? A heart attack is when we damage the heart muscle. The heart's a muscle. It's basically just a pump that pumps blood throughout the entire body. You can damage the muscle with a blood clot in the arteries that the heart uses to feed itself. So a heart attack is heart damage from a blood clot. Clots, remember that theme. A heart attack does not have to kill you suddenly. It may. You can have a heart attack, meaning a blood clot in an artery that damages the heart, and you can drop dead. We call that sudden death, but that's actually not what normally happens, although it certainly can. Usually a heart attack damages the heart and will kill you slowly over time, which we'll get to. So isn't that the same thing as heart disease? Well, heart disease is any condition, not just a heart attack, that can damage the heart or make the heart weak or not work as well as it should. And that may sound kind of vague, and that's right, but a heart disease as a term means anything that makes the heart not work well. And likewise, heart failure is a very non-specific term we use for any situation where our heart is failing to meet our needs. Any situation where a heart doesn't do for us what we need it to. And that may sound really vague, and that's right, because heart disease is when the heart has a damage or problem so it doesn't work well. Heart failure is when it's just not meeting our needs, and that's all pretty vague. Well, how about a stroke? A lot of times people throw around the term stroke and heart attack interchangeably, and that's because they're a lot alike. A stroke is basically a clot that damages the brain. A heart attack is a heart clot, blood clot, remember, that damages the heart. But when it's brain damage, it's a stroke. Heart damage, it's a heart attack. Hypertension. Oh my goodness, people talk about hypertension a lot. Hypertension is just a fancy Greek word for high blood pressure. But we have to remember, blood pressure is a number. Blood pressure is not a disease. The number only has meaning in context. Different numbers mean different things in different circumstances. Now, it's really a reflection of the health of our arteries, which we'll get to because the heart is pumping blood throughout the body. If your blood pressure is too high for too long and you overwork the heart, that can beat up the heart. And yes, hypertension may lead to heart disease or even heart failure. Atrial fibrillation, that's a term we hear an awful lot because it's extraordinarily common as we get older. Atrial fibrillation, or AFib, those are synonyms, AFib or atrial fibrillation is just the sustained irregularity of your heartbeat. It happens with age. You don't even have to know if you have atrial fibrillation, but if you do have atrial fibrillation, it can lead to a heart that doesn't work well. It can lead to heart disease or even heart failure if we don't manage it. And atrial fibrillation is also a major cause of strokes, brain injury. So these are all different terms that we commonly use, but this gets down to saying heart disease is like engine trouble for my car. We don't want to have engine trouble any more than we want to have heart disease, but it's not one thing. It's not the 1900s where heart disease was just heart attacks, or the early 1900s where heart disease was just rheumatic fever. These things don't happen the way they used to, and they don't have to happen the way they used to because we can build upon our health. And so heart disease is not one thing. We need to know why our engine isn't working well, why our heart isn't working well. We also have to acknowledge that the older our car is, the more maintenance it's going to need to run well. In other words, our hearts, like our cars, do require maintenance if we want things to work right, especially as we age. So here's the first shocker. There is almost almost no such thing as heart disease. It's really just natural aging. It's important to remember, and this is a major theme of how we now in the 21st century understand how to manage heart health, because we are managing natural aging. Second shocker, there's a lot more to heart health than just diet and exercise. To me, that means you can relax a little bit, because in the 1900s, we always had this notion of naming and shaming. We would name every condition and tell you it's your fault that you had it to make you feel bad. But you know what? It's not just diet and exercise. If it was diet and exercise, rabbits would live forever, and you know what? They don't. So there's a little bit more to it than that. In fact, guess what? The passage of time matters an awful lot, and our genetics mean an awful lot. So there's some things we can control, but some things we have to acknowledge are beyond our control, but that still gives us an opportunity to manage things. So it's not all our fault if we get old, okay? It's part of the process. So again, heart disease is really just a manifestation of how we naturally age, and there are several things that happen to all of us as we naturally age. We have chronic vascular inflammation, which is the wear and tear on arteries. We lose vascular compliance or get a stiffening of our arteries, and we lose the reliability of our heart's natural pacemaker, the tempo keeper of the heart. Chronic vascular inflammation, that's what we mean by plaque or atherosclerosis, and I'll take a moment to explain each of these. Plaque buildup in arteries as chronic vascular inflammation is a function of time. Loss of that vascular compliance or the stiffening, we commonly call that hypertension, but guess what? It's really just a manifestation of how arteries naturally age. They stiffen. And that decrease of our heart's ability to maintain a reliable, steady rhythm, that's what we call conduction disease. It gives us what we call sinus bradycardia, or a slow heart rate, which is what leads us into atrial fibrillation or the sustained irregular heartbeat. So these are the things that happen to everybody over age, and I'll explain them just a little bit. We used to always talk about, in the 1900s, the risk factors of heart disease, as if heart disease was one thing. But we're trying to get away from this notion of calling everything a risk factor. Why? Because it's not a game of chance. It's not a matter of chance, it's a matter of time. We are all going to age. If we say risk factors, that implies that, oh, if I'm lucky, maybe I can dodge this. You're not going to dodge aging. None of us are going to dodge aging, but that's okay because we know how it happens and we can manage it. So the first thing that happens over time is chronic vascular inflammation, or the wear and tear of circulation. Why does this happen? It happens because, you know what, the heart's a moving part. All moving parts can wear out. We have 100,000 heartbeats every day. That's a lot of continuous pounding, continuous trauma. Every artery gets smacked around 100,000 times a day. Imagine poor William Shatner at the end of the day. If he slapped himself 100,000 times, he would tear off his skin and cause all sorts of trauma and damage. And you know what? We heal that. We heal that because we're built to heal trauma. That's what inflammation is, our natural healing. Healing leads to clots, scabs, scars. That's all a natural process. When this happens on the inside of our arteries, that healing process is how we develop plaque. Arteries change over time from chronic vascular inflammation. That's the first thing that happens to arteries. So it's like rust in a pipe. I always find this picture, you see it show up in a lot of our foundation talks to remind us, pipes rust, just like our arteries do. The chronic inflammation and healing over time. This is a steel pipe, this isn't a human body, but it's still kind of gross because it's important to remember that we want to stay clean on the inside. This pipe is not blocked. It's not blocking flow. This isn't the 1900s. We don't have to just wait for a pipe to block flow before we try to keep it clean on the inside. All that gunk can break off and float downstream and start to jam things up. That's not what we want to happen. So we need to get over this sense that blockages are the problems. We know that it's more important to keep a pipe clean and healthy before it's totally blocked off. There are a lot of ways to know how healthy your pipe is. This is an example. This is Denise. Those of you who come to our practice may have met her. She takes pictures of arteries. You can do an ultrasound to look on the inside because we don't really know our health on the inside until we look. It's not a screening test. It's a test that documents how age has affected us. What is our plaque burden or disease burden, if you must? How much plaque have we grown over time? Here is an example of a nice healthy artery. Blood's flowing through this. This is a black pipe. Well, it's black in this picture showing good healthy blood flow. Now this is an artery that has plaque in it. I always thought this kind of looked like a slug with a couple of eyes on top of it. This is somebody not much older than I am who just came into my office and let us look at his arteries to see that there was plaque already there. And more importantly, I'll draw your attention to this little spot in the middle. You can see something moving. That thing that's moving here in the middle is a blood clot on that plaque. It's not that he did or failed to do something, and he certainly didn't feel that, but if that blood clot breaks free, because that's right below his brain, that clot will land in the brain, kill off something, and that's a stroke. Same sort of thing can happen in the arteries to the heart and damage the heart. It's important to remember this artery is not blocked. It is not blocking flow, but it does have age-related plaque growth, and it does have a clot. Again, part of the natural aging process. So rather than saying risk factors, we can ask, what are the things that accelerate vascular aging? What are the things that make our arteries age faster? And I wrote this list in kind of an order of importance. The first is diabetes. Diabetes, or what in the 21st century we think of as a genetic metabolic mismatch, or we are eating things that we are not genetically well prepared to metabolize. And so if we don't metabolize what we're eating, we store that. If we store things, we have elevated blood sugar and resistance to insulin. Insulin being the hormone that helps us metabolize sugar. Oh, so diabetes then is associated with all this calorie storage. As we gain weight, we're not burning calories, we're storing them, we become resistant to insulin. And that combination, the insulin resistance and higher sugar, dramatically accelerates vascular aging and plaque growth. If you have diabetes, you can grow plaque very quickly in your arteries. It doesn't take decades, it can take years or even months, depending on how much inflammation you have in your arteries. This is where diet comes in. Food is not toxic to the heart directly, but food may not be metabolized. It may accelerate the metabolic syndrome, prediabetes or diabetes or insulin resistance, and that may accelerate plaque growth. So, I'd like to point out there are some things we can control and some things we can't. I'm somewhat of a diet heretic. Can we overwhelm our diet with the right medical management? The answer is mostly yes, but diet does matter, particularly if your metabolism is leading to diabetes. The second thing on the list of that which accelerates plaque growth, accelerates the aging of our arteries, is smoking. That one's pretty easy. Nicotine is also problematic, so the vapors, you're not off the hook. As a matter of fact, if you're vaping, I wish you would smoke, because at least you have to work at it. But diabetes and smoking are the major things. Look what I put way down on the list. Third, cholesterol. This is in the 1900s. We stopped treating cholesterol a long time ago because we treat people, we do not treat numbers. If you're growing plaque, and we need to manage that. I didn't say we have to treat your cholesterol. I said we had to maintain the health of your arteries. Blood pressure. Blood pressure is its own problem, which we'll get to, but it is true that higher blood pressure pounds on arteries more and accelerates vascular inflammation and will accelerate plaque growth. But mostly the thing that's in each of our control is understanding our tendency and how we manage our metabolic syndrome. Don't have diabetes. And so if we want to slow down natural aging, if we want to control plaque growth by our efforts, you manage these things. Don't allow yourself to have diabetes if you can help it. Even if you can't help it, get help with it. Don't smoke. Be mindful of your cholesterol and pressure. That's how you slow down natural aging and plaque growth. But can we stop plaque growth? That fellow that you saw with the plaque, is there a way to actually arrest and stop and even reverse plaque growth? There is. It's a statin. Take a statin. Yeah, it's really kind of that simple. If you take a statin, especially if you start early enough in life, we will inhibit the mechanism of plaque growth. We will dampen vascular inflammation, and we may even cause regression of early plaque growth. So in a lot of ways, it is that simple. You take a statin, you don't have to have plaque growth. Heart attacks may become as rare in this coming century as rheumatic fever is rare. Rheumatic fever is when we didn't have penicillin. Kids got strep throat and it chewed up the heart, and they all had heart failure because the heart valves fell apart. That doesn't happen anymore because we have penicillin. Heart attacks are becoming a historical memory. They're still out there because we still have a lot of diabetes and a lot of smoking, and not everyone has gotten the message that you can stop plaque growth with statin therapy. There is a small number of people who have trouble tolerating statins, but a lot of that is perception. That's been studied. You can all look up something called the nocebo effect. A placebo is where you think something helps you, whether or not you're doing it, or it's whether it's a sugar pill or a medication pill, you still have a benefit. A nocebo is where you think you're going to anticipate a side effect. You think something's going to make you feel bad before you've even started it. And it's pretty clear that statins in a small percentage of the population have a strong nocebo effect. People will have aches and pains just at the thought of taking a statin, even when they're not on it. I'm not sure I can help you with that, but if you understand your plaque burden and you don't want to have heart damage or brain damage, you need to work with somebody on how to stop that plaque growth. And if you're 98% of the population, you can simply take a statin. And yes, it's really that easy. So here's another shocker. Taking a pill does not mean you're unhealthy. Actually, quite the opposite. Taking a pill means that you care enough to maintain your health. I'm a 50-something-year-old guy. You better believe I take a statin because I don't want to grow plaque. My father had a heart attack and died not much older than I am because we didn't have statins back then. But we have statins now. And so, do I think I'm unhealthy? Not at all. I've seen my arteries. I've gone on a treadmill. My techs make me prove I'm healthy every couple of years so that we all stay gainfully employed. That's great. Taking a pill does not make you unhealthy. A lot of men and women my age say, I don't want to take a pill. That'll make me that means I've got a problem. No, it doesn't. It means you're simply getting older and we're doing the maintenance required to build a future of health. Be kind to your future self. Be kind to your brain and your heart by not allowing plaque to grow. That does not mean you're unhealthy. Okay, next thing. What else happens as we age? The next thing that we have to think about is stiffening of our arteries. Everybody's arteries stiffen over time. We call that a loss of vascular compliance. That's a natural process because arteries are made out of collagen. The collagen proteins lose their elastance over time and they get stiffer. So a stiffer pipe will be under higher pressure. Again, if you look through our foundation videos, you'll see that we emphasize repetitively that blood pressure is not a disease, it is a number that must be interpreted in context. There is not one number that means the same thing for everybody. So please never panic about a number. But help us understand, or let us help you understand what that number means. A stiffer pipe means higher pressure, and higher pressure is going to mean more work on your heart. If you make the heart work harder, it'll change, and it can take years to decades to really make changes, but they matter. They matter quite a bit. You see, the heart is a muscle. It beats. And the heart really likes exercise. Like this young woman lifting high repetition, low weight, staying nice and fit. The heart as a muscle loves to exercise, but it does not want to be overworked. This fellow here, he's pumps iron, big heavy weights, lots of work, and his muscles get big and bulky. And if he wants to look like that, if you want to have your body muscles look like that, more power to you. But your heart does not want that to happen. So higher blood pressure over years, not over minutes, over years will overwork your heart and can lead to the thickening, bulky muscles, which is a problem. So in men, the stiffening of arteries happens very reliably, typically starting in our 40s. Now, not every person has to be labeled as a disease or needs to take a pill, but we all need to factor in the stiffening. Women have the stiffening much later in life, and it's not a stepwise progression. It can happen very rapidly. 60s, 70s, you can have a sudden marked increase in vascular stiffness, which tends to give transient increases in blood pressure that like to cause panic in people because one number was high. This is a natural biologic process. We don't ignore it, but we never panic about it. What we want to know is how has it affected the heart, and what is the health of the heart? And if you want to know, you need to look. Remember, hypertension is called a silent killer because it does not produce symptoms. Hypertension does not produce symptoms until you've beaten up the heart. It is silent, but it is not invisible. So you can look. Again, here's Denise taking pictures of somebody's heart. You can see this. This is an echocardiogram, which is a cardiac ultrasound, or an echo for short. This is how we examine the heart. Typically, if I meet a new patient, I will have them get an echo before I even see them, because anything you might tell me about what you're experiencing or what your questions are, if I don't understand what the actual health of your heart is, my answers are going to be at best guesswork. So it's part of a normal examination of the heart in the 21st century. So here's an example of an echocardiogram. This white wall here is the heart muscle. The black is the hollow chamber on the inside. As the heart beats, blood goes in, blood goes out. These floppy things are heart valves. Don't worry, it's not a quiz. I just want you to have a sense of what are we looking at. And it's not one picture. We obviously take dozens to hundreds of pictures if we need to really see the heart. But this is a healthy heart. This is like her, with healthy muscles, trim and fit. To be clear, it doesn't mean you have to look like this on the outside. We're just using this as an example of what a healthy heart looks like. But now here's a heart of a fellow, a man, who had high blood pressure for 20 years. Pressure's over 200. Of course he didn't feel that. You don't feel that. You actually feel pretty good because high blood pressure is improving blood flow, and he had all sorts of energy until his heart got so thick. And if you watch it beat, this inner chamber is so small that even sitting still, his heart essentially was doing everything it could. In other words, it was at maximum capability just sitting still because his blood pressure was so high that his heart got this bulky. And if his heart is at maximum capability sitting still, what do you think happened when he gets up and he tries to walk around? If I'm walking or running or being active at all, my body needs my heart to do more. But if you're at 100% sitting still, you can't do more. And so he was breathless and has a form of heart failure with even minimal activity. Why? Because high blood pressure beat up his heart over years, and he didn't feel it until the heart was finally not working well. So it's kind of like this fellow with the big, bulky muscles. And again, body muscles, you can make as bulky as you want, but this fellow isn't terribly limber or flexible. And we need our heart to maintain its flexibility and fitness. Okay, so if we want to slow down the aging process to avoid excess vascular stiffness, how do you do that? Aerobic exercise. Aerobic exercise is extraordinarily important. Notice I didn't say aerobic exercise would make you exempt from plaque. Plaque is an inflammatory issue. The body likes exercise. Exercise doesn't make plaque worse. Exercise does make the vascular stiffening progress at a much slower rate. It's a very good thing. But keep in mind, just because you're fit and exercise does not make you exempt from vascular inflammation and aging. There are all these reports of these young guys dying of heart attacks, the husbands of tech entrepreneurs who died on a treadmill at my age. because they mistook fitness for health. Just because you're fit didn't make you exempt from vascular inflammation and aging, but exercise absolutely helps with vascular compliance, keeps the heart from having to work so hard against the stiff pipes. So time and genetics are the most important things, but our diet in terms of diabetes and contributing to plaque growth, and our exercise in terms of good vascular compliance and not overworking the heart. Exercise doesn't overwork the heart. It helps the heart work well on demand. Now, salt. Salt is not toxic. It's not like if I eat salt, my heart's going to explode. But the human body is basically a bag of salt water, and if we eat salt, we will hold on to extra water to keep it dilute, which means we are overpressurizing these pipes if they're stiff. Young women tend to have very flexible blood vessels, and we have to give them a lot of salt where their pressure's too low and they can faint. When we get older, if we have extra salt, we do overpressurize things. But it's important to realize that you're never going to have a zero salt diet. All living things are based on salt. So lowering salt is helpful, especially if you have that heart that's stiffer, thicker, and the pipes that are stiff. So salt does matter. And if we really need to slow, can't necessarily stop all that stiffening of vascular aging, but this is what medications are for. If you want to slow vascular aging on top of being fit, we have a pill for just about everything, but we don't have a pill for fitness. So you need to take a pill. When your doctor says it's time to treat your blood pressure, what we're really doing is promoting the health of the arteries, maintaining the health of the heart. We can reverse some of the effects of pressure overworking the heart and some of the effects of time on our arteries. And those are the medications. There are different medications. Different people are going to respond better to one medication or another, so it is not a one-size-fits-all thing. So here's another shocker. If we really want to stop aging, not only are we going to likely have to take a pill, but we're likely going to have to take more than one over time. Some people need to start medications for cardiovascular health in their 40s and 50s, others in their 60s or 70s. Yes, I have started 90 and even 100-year-olds on medications for the first time, because some people age a lot later in life. But none of us are immune from it, and it's okay. It doesn't mean there's anything wrong. It's wrong if the system doesn't work and it's failing and you damage your brain because you didn't get blood to your brain, or your heart can't keep up with you and you have heart failure. So if you'd rather that not happen, then you build your health. And you can do that with your doctor when necessary, meaning you may need to take medication to stay healthy. Okay, there's another process that happens over time. Another process that happens over time is the decreased reliability of our heart's natural pacemaker, the thing which generates the heartbeat. Because the heart is a muscle, it beats when it's told to beat. It's told to beat by our natural pacemaker, something that's called the sinus node. So this heart muscle has one little corner of it that sends out a signal that says time for a heartbeat. Time for a heartbeat, time for a heartbeat, and that makes the heart muscle contract, squeeze, and generates a heartbeat. It's called the sinus node, so a normal heart rhythm is called a sinus rhythm. It's just the name of it. So I compare that to a marching band. The guy up front, that's the drum major. The drum major sets the tempo, and everybody in the band follows and stays in step. This is the Marine Corps band, marching in step, in precision. That's a normal heartbeat. This is a comparison, our heart's natural pacemaker and the heart staying in step. But pacemakers get old. This drum major gets old. May have worked great, and as we get older, the drum major gets slower. This is that standard chart we see in all the gyms that say, oh gosh, my heart rate gets slower. And you could look at this and think, well, I'm not going to run as fast at 80 as when I'm 18, but that's not what this chart tells us. I got 80-year-olds still running half marathons. You know who you are, and that's awesome. But it doesn't mean that your heart can generate a faster heartbeat. So the drum major is what ages, not the ability to beat. It's just the signal. And so when that happens and the drum major checks out, this is my alma mater, not the Marine Corps, the band can be out of step and it can be completely chaotic. And if the band is completely chaotic, we call that atrial fibrillation. No organized heartbeat. You can see that on the EKG. You don't necessarily feel it, but a disorganized heartbeat is atrial fibrillation. Organized and regular, like the Marine Corps band, in step, following the pacemaker. Disorganized, with or without a drum major, can be irregular, or is irregular. We call that atrial fibrillation. A couple of things about AFib. Why exactly do we care if we're irregular? We care mostly because if the heart is beating in a disorganized way, blood does not flow smoothly. And when that happens, that allows it to clot. Again, clots. If a blood clot leaves the heart, it'll land in the brain, give you brain damage. If that happens abruptly, if it's a stroke, it can also hand it chronically and just kind of make you demented from inadequate blood to the brain. So we don't want that to happen. A couple of really scary facts. If you're 70 years old, particularly if you have a history of high blood pressure, 1/3 of people will have at least some atrial fibrillation, and the majority will not feel it. 90% of atrial fibrillation is asymptomatic, subclinical, we say. You have a regularity that you are unaware of. And that matters because as little as 5 minutes of atrial fibrillation will double your stroke risk. Now keep in mind that's a relative number, so if you're otherwise healthy, your stroke risk may be a relatively low number, so doubling it is still a relatively low number. But as we get older, that number really starts to rise. And atrial fibrillation is perhaps the major driver of strokes, that and plaque buildup. And AFib can also really wear down a heart. So it's very common. And in the 21st century, it's the most common relevant issue leading to heart disease. The whole plaque thing, we got that. Take a statin. Not going to be a problem. The pressure thing, everybody knows that pressure is an issue, even if they don't understand why, and people love to perseverate on their numbers, but we can recognize high blood pressure. That's pretty easy, and we can help you manage that. But this conduction, meaning the electrical system, that's something I can't stop. There's no statin for the sinus node that's going to prevent your sinus node from aging, and AFib happens as we get older, and the irregularity causes a lot of problems. So a slow and or irregular heartbeat is the most relevant driver of heart disease in a population over 65. And that's going to be the big deal into the 21st century. So in modern times, heart disease we can think of as arterial disease, like the result of heart attacks, big ones, little ones, that all add up and damage the heart. Hypertensive disease, stiffer arteries that maybe we under-recognize and we allow the heart to get beat up. Conduction disease, a heart that's too slow. Remember, a slow heart when you're older is not protective. If you only have a couple of heartbeats to meet your needs, everyone's got to do an awful lot of work, and that can strain the heart. And more importantly, you simply don't have good blood flow, and that can start to starve off other organs in the body, like the brain. You really don't want to have too slow a heart if you're not getting blood to the brain, and the irregularity can wear down the heart. I didn't mention bad heart valves. That's another issue, but heart valves are much more complicated, and there's not a lot you can do about it. You're going to need the help of a cardiologist if you have a bad heart valve. Again, this is why everybody at some point should have their heart examined to know whether you have a heart valve problem. Arterial disease, entirely preventable, period, full stop. Take a pill when your doctor says it's time. Hypertensive disease, entirely manageable, even if not totally preventable with the stiffening. Exercise is going to matter a lot, an awful lot, and medication when you need to. Conduction disease, okay, there's a certain inevitability of conduction disease as we get older, but that too is very manageable. You don't cure AFib, you manage it. You don't allow it to give you heart disease in terms of a weak heart or heart failure. These are all manageable things, sometimes with pills, sometimes with procedures. Everybody experiences it a little bit differently, so it's not a one-size-fits-all affair. What to do? Think about what we say at the foundation or the Foxhall formula. It's the heart. That's for my sake. It's the heart, dummy, for me. D, your doctor. Have a relationship with your doctor to understand your health and how you're building it. There's more to health than just the heart. Real doctors like to point that out. I'm just a cardiologist. But you need to have a relationship with your doctor so you can build your health. Ask about H, your heart. What's the health of my heart and how do we know? Have you actually had it checked? Because this is all silent killer stuff. A, what are the health of my arteries? How do I know? R, what are my rates and rhythm? And how do I know? There's all sorts of technology, EKGs, monitors, Apple Watches, all sorts of things you can start to understand your rates and rhythms. T, is it time? Is it time to do something? Is it time to take a pill or time to do something else to help build my health for the future? And remember a couple of shockers. First, there's almost no such thing as heart disease. Yes, there are weird things out there that can affect people, and I didn't talk about heart valves, but most of this is simply just a function of natural aging, which means it's knowable, it's predictable, it's measurable, it's manageable. 2, there's a lot more to it than diet and exercise. I have some people who think, I can do this all myself, I can eat right and exercise, and I will be completely exempt from the passage of time and completely exempt from my genetics. No. And then I got some people who are like, yeah, I don't want to do anything, just give me a pill. I can do a lot with pills, but if you don't maintain fitness, you can be breathless just walking across the room. And yeah, you can stay alive an awful long time like that, but I'm not sure you really want to. So it really takes both sides. There are things that your physicians can do with you and things that you kind of need to do yourself. There's no pill for fitness. Next shocker, possibly one of the most important concepts of the 21st century. Taking a pill does not mean you're unhealthy. It means you are actively maintaining and building your health for the future. And in fact, if we live long enough, you likely are going to benefit from building a future health with more than one pill. And oh, another shocker I didn't mention, if you're healthy and you live long enough, you will have earned the right for a pacemaker. I have a growing number of 100-year-old patients. All but one of them has a pacemaker. And these are active, healthy people with sharp minds. They didn't get vascular dementia from having not enough blood flow to the brain. They didn't strain their heart from being too slow and have unrecognized atrial fibrillation and develop heart failure. So someday, we're going to publish this data soon enough. The average age of our pacemakers for people with a slow heart turns out to be 82. And they do great. So someday, if somebody says it's time for your pacemaker, think about that, hey, I may live to be 100 or 110, and I want to do it well. I don't want to be slow, I don't want to be breathless, I don't want to have the brain fog, cloudy and forgetful. Not that we're going to cure everything, but think of this as a reward, not as a punishment. Oh, I'm living longer, great, my heart's strong and healthy, it's just too slow. Fine. What should you do? You should have a doctor. A lot of you seeing this video already have a doctor, but I give this same talk to a lot of groups where people don't have a regular doctor. You want to establish care with your doctor before you're sick. Everybody is crawling out from behind our hidden caves towards the hopefully end of the pandemic. There is a lot of data out there. The CDC said we had 1 million excess deaths because of COVID. A lot of that, not 1 million, 100,000, sorry. But the point is, it's not just COVID that's been affecting people. It's the lack of interaction with the healthcare system, with your doctor, maintaining your health. Have a doctor before you're sick and maintain that connection. Know your family history, know your genetics, but don't go get one of these genetic testing with, oh, you have one of the 17 genes recognized as leading to vascular aging. Okay, guess what? I'm going to have vascular aging. If you want to know your real genetic risks, ask this question, or what I ask all of my patients. What about the health of your parents? Do you know your parents' health? Do you know why they died? Oh, they died of heart disease. Really? Okay. Was it good old-fashioned ischemic heart disease because they smoked and didn't have statins? Did they have AFib? Oh, they had vascular dementia. Oh, they probably had under-recognized AFib, high blood pressure or whatnot. What do you know about the health of your parents and your siblings? And if you have an issue, oh gosh, I had a heart attack at 52. You know what? You need to tell your siblings and you need to tell your kids. If you had a heart attack at 52, that means you started growing plaque in your late 30s. Oh, really? Yeah, really. And maybe your siblings deserve to know that because they may have genetics like yours. Let them look. Don't put your children and your siblings off at a disadvantage. Not everybody likes to share health information. I get that. But you should at least try to find out what you can about your own family. Next thing you should do is not smoke. That's pretty easy. Just don't. And take a statin when somebody says it's time, okay? And we are starting statins now routinely in 40-year-olds, sometimes even younger. And we're not treating cholesterol. There's one study that showed vegetarians had higher stroke rates, and that was probably because they had a lower tendency to be on statin therapy because of the very common misconception that diet alone will treat cholesterol. When we're not treating cholesterol to begin with, we are preventing vascular aging. So when you have vascular aging, take a statin. And take aspirin. There's a video, go back and look on the Foxall Foundation YouTube website titled Don't Stop Your Aspirin, so you can understand that once somebody has asked you, your doctor's asked you to take an aspirin, don't stop it. And take your blood pressure medicines when your doctor says it's time to do that. And we all need to exercise. We all need to be fit. You got to keep moving, okay? It's an important thing because what's the point of having a heart that works if nothing else does? So final message is no one is immune from aging. You can't change your genetics and you can't deny the passage of time. You don't know your health on the inside unless you look because symptoms do not predict risk. There's this horrible truth that I'm more interested in how you look than how you feel. I've been told that makes me profoundly insensitive, but how you look, the health of your heart, how well does it beat, the health of your arteries, what are your rates and rhythm, those are the things that are going to tell me what's going to happen to your heart. The symptoms are all really about the same. If your heart doesn't meet your needs, your pump isn't keeping up. So you will be tired, weak, loss of energy. You have evidence that you're not getting good blood flow. Some people feel run down, maybe you get breathless or, but those symptoms are so nonspecific. I don't have to wait for you to feel bad to want to ask, what's the health of your heart? Once you do know the health of your heart and your circulation, then you can know your options. Diet and exercise slow down the aging process, and sometimes we cheat. We stop it or even reverse it with pills and procedures. And please remember, prevent is an active verb. We did publish all this not that long ago in our book, You Can Prevent a Stroke. This talk is mostly about heart disease, but as you can imagine, they're linked. If you don't have a good heart, you're not going to be able to protect your brain. So preventing a heart from failing is one of the critical parts of maintaining health. So everything that we mentioned in this video pretty much is in the book. You can get that from your favorite bookseller. Support your local retailers if you can. Subscribe to this YouTube channel, the Foxall Foundation. We try to give weekly updates. And remember, build your future health. Thank you.